Our first stop takes us to First Day Homecare. First Day Homecare was formed from the desire to take a passion for helping the medically fragile and turn it into purpose. If you are an RN LPN nurse, First Day Homecare has job positions open across the entire state of Michigan.
First Day Homecare is a pediatric private duty nursing company. We provide shift-based nursing services in medically fragile children's homes, so infants and children who have things like tracheostomies, ventilators, and feeding tubes. Our nurses are typically in a patient's home for anywhere from 8 to 12 hours for a given shift. And these kids have this staffing in place 7 days a week to help keep them well, keep them healthy, and out of the hospital. We're looking for licensed registered nurses and licensed practical nurses here in the state of Michigan who really are going to be ones to provide compassionate and safe care to infants and children in their homes. Private duty nurses have a unique opportunity to go into these medically fragile children's homes and really make an impact on the patients and their family members' lives. Our nurses are there to support our patients not only from a medical standpoint, but also from a developmental standpoint. Our nurses get to provide a lot of quality care with our patients. There is downtime in private duty nursing, which is kind of a nice thing as opposed to some other care settings where it's kind of hustle, bustle, go, go, go. In private duty nursing, you have those moments to really spend quality time with your patient.
So for private duty and for First Day, my patient, I go to their house 3 days a week, usually 12 to 13-hour shifts just to help the parents out because they both work. One of the main things I'm here to watch and take care of is her trach. Trach suctioning is a big role in private duty nursing. If her trach becomes clogged or something happens and she loses oxygen, that's very vital and very important for her. Other healthcare things we do are G-tube care. She's got a feeding tube. We also do some medications through that, breathing treatments, and then range of motion as well as physical therapy. So strengthening things as well as nursing care. When you only have one patient to focus on, I feel like I'm actually able to help and take care of my patients properly, and I just feel like I'm providing safe nursing care. My favorite thing about private duty nursing is the one-on-one care and actually getting to make a connection and a relationship with my patients and their families. In a hospital setting or an acute care setting, you're constantly switching patients and you don't really get that one-on-one connection and that care, and that's a good feeling.
The role of a private duty nurse is an incredibly important one. Some of these babies and children are actually kept at the hospital until a private duty nurse is identified for that child to come home from the hospital with. Our nurses actually have an opportunity to help bring some of these medically fragile children home for the very first time in their lives. Some of them are born prematurely. They might have a congenital anomaly that has caused them to have a tracheostomy in place. And these kids have been living their entire lives in the hospitals up until they're 5, 6, 7 months old sometimes, and it's our nurses who really help to bring them home to their families. If you're an RN or an LPN who would like to make an impact on a child's life, we would love to talk with you. You can call or text us at our phone number or go to our website at www.firstdayhomecare.com to check out all of our available positions.